doing with
Yeah, what are you doing?
Okay, your arm was up here, his arm's forward. So like I said, I'm changing the center of gravity. John, I can go after his chest. So the biggest thing that's been happening with John is his chest now is fusing back. So the way he rotates over his vertebrae has been altered because he's had to hug a pillow. Any of this kind of tension pulling back on the rib cage has been a no-no. But he's now, gosh, I can't believe it's at, we're going into what, 3 months?
12th week.
Yeah, 3 months into the surgery. So I really don't care now if I pull back. Because another thing with when you have a chest cracked open, well, guess what? You can't lean over your pelvis because of the weight that way through the chest is very painful, the gravity. So John has altered all of these movements because he's protecting himself.
He's accommodating.
Correct. But
Yeah.
now I'm trying to tell him he's well enough now. So as he goes to hammer something and come back, that whole movement, that he's okay to start
Becomes
doing
more
that.
fluid and natural.
And he's still holding his breath probably a little bit because it's not completely healed or tight or whatever in the chest. And so he's getting it counter with the lower back.
Exactly. Whatever you said, exactly.
What a smart man you are, John.
John pays attention to my lessons. He enjoys it. He asks good questions. I really enjoy John, and I really try and think of stuff just because John's what? Gosh, we've been going on 3 years now with lessons.
Really, that's awesome.
And he comes every other week. His wife comes every other week, so we take turns. So that's why I was confused. John. So anyway, when you've been seeing someone that long, you start thinking, what do I get to do today to stump him? Because he'll. I tried this one thing recently just with the behind here, the torque and whatever. Unbelievable what it did to his neck and back. Just from what I was going, the rotation through here, I was doing through here.
And you've been skipping over that little area forever, huh?
I just didn't know it existed.
I know.
So see, just like I'm bringing the shoulder back, same thing, analogous parts, I'm just bringing it over the vertebrae. See how I'm slowly rotating the vertebrae to bring him around. Now, as always, John, if I touch you in any way that's uncomfortable, you let me know. So now I think I've done enough. Not that he's done for the hour. I'm going to go after the arm. I'm going to do this very slowly. I have to find your lifting point. So see it more and more here. The organization or the lack of around any of the shoulder to pull this arm back. So see up until now, and he just gets heavier and heavier. So now with that. And also John's 6'4", so I have to change for his anatomy. But again, so see now, I'm slowly rotating the arm to come over the back. But right here, do you feel how heavy your arm is, John? So that's where your back's hurting. See how for you to go do work to bring your arm back?
Well, maybe after Saturday is when the mud and tape guys. So we're under the gun right now for getting things ready.
Well, I thought you were all ready. I talked to Teresa yesterday, and she's like, they're just waiting for him. I'm like, okay.
Yeah.
Well, there you go. Perspective is everything, huh? Different point of view.
So we're moving the dining room chandelier light location because they're going to pull all the popcorn ceiling off.
Yeah.
Good time to do it. And,
Yeah.
What else? I got 5 of the 8 can lights installed. I got 3 more to go. I tested on what I did last night and they all work. Get the can lights in and that living room light thing relocated. That'll be just little odds. And I left Esther with a big list of little minor things. Pull all the cover plates off, plugs, switches.
Oh, this will give you for imaging. So he's telling the physician's assistant he's doing baseboards, and the guy's like, we need to talk. Because had a guy, open heart surgery, went to help his wife move the refrigerator, and literally his chest popped open.
Oh,
He's like, can we wait till you recover a bit more before, you're not supposed to be lifting over 5 pounds for a reason.
oh.
He killed me for 3 weeks with that image.
Where do they split the chest? In the middle of the sternum?
Right down the middle of the sternum.
Wow.
So you don't have to worry about the cartilage, the bone fuses.
Oh,
Knits back
gotcha.
together.
And
And they wire it.
Yeah, I've got
oh,
about 2 feet of stainless steel wire.
good thing.
He says every
Sounds
time
like-
you get an x-ray, that's gonna really light up.
So see here, all the stuff we were just looking at,
Yeah.
I still can't rotate that shoulder. See how the right there, the shoulder is not flagging, just like I showed you with the elbow on yours.
Okay, now I get a better sense of what you mean by flagging.
There we go.
You mean going like this?
Feel that, John? That was the first time I could lift the arm.
It's more like a flag in a golf
Yeah.
tournament cup.
There we go. See, look at the difference now, when the arm was able to lift. So now I can go back here. Again, I'm connecting the elbow and the shoulder to the back, but here, see, you can see where the shoulder stops, so I'm not ready yet. But I'm still gonna, so here, look at the difference. Right here,
Mm-hmm.
one thing was with that, watch the,
Oh.
but here, for some reason here, the rotation's different. Here, look at the rotation, the shoulder. So see the rotation, how the shoulder comes behind the chest cavity?
And then do the other again?
Here, and then here, I'm gonna hold the middle of see the difference? The elbow comes back, but the shoulder stops rotating back.
You're getting very
So
close to
here-
my sore back.
See the difference?
Ah.
And here, no. So now, like he said, so I'm getting close to the sore back. So I'm gonna bring back the arm just a little bit more, so cantilevers off the chest cavity. I'm gonna leave him in this position, and I'm just right here. See how minute I am to work on that rotation of the rotor cuff around the lower back. And there we go.
So you're working it backward and forward.
Wouldn't
And at the
surprise me
same
if you were
time-
twisting a little.
Yeah, well,
Yeah,
I'm always
yeah.
twisting.
Yeah, always twisting. That's the
She
name of
discovered
the
torque
new
and she
game.
loves it.
So
Well,
now look at the difference.
Yeah, wow, my gosh.
So now what's still not happening, and this is really advanced stuff, notice how I can't get his head to move. So right now, even I'm pulling back
Oh,
here,
I'll be darned.
see how? The
Yeah.
head's still, now that could be a couple of things. The pillow's a little bit higher than the spine, I get it, again, he's 6'4", but that's just a subconscious thing. So now again, just like I did with you, my elbow's here against his elbow to secure his, so now I'm here looking for when the scapula can come behind and work better with this shoulder. See right there? Now the head starts to move. Now he could have started moving it because his brain goes, oh, that's what you want? But now
Right,
look at the difference. See?
Right.
See? And now that ricochet, and the head can fall.
Yeah, is.
Tighten your left arm, John. Let go.
That tightened up too.
Oh, I know. Well, that's where you're working with the hammer or holding the nail. Your vision's bad, so you're holding the nail tight there, and that's where you're hurting the arm here or forcing it. And this is walking.
Oh, this is beautiful. I love seeing that.
Feels good too.
Oh, I know.
Oh my
Now I'm
God.
tingling down my legs.
Okay. I'm not going to tell you who said it because it's your neighbor, but someone new came to me, and she goes, "Oh my God, her touch was so gentle." He told this to somebody else. He goes, "I just wanted to take my clothes off and have her touch me."
Well, I think his brain is thinking along the wrong line.
And I'm like,
I
almost,
think so,
I was
I think
almost
so.
like TMI. And see now,
Yeah, for sure.
now look at how I finally had the shoulder behind.
And I've been going through life all tense.
Well, you'll be surprised when you stand up.
No, I've
No,
already
no.
been there. Oh, ouch.
Okay,
No. That is my sore back.
Right.
And hurt me. Go ahead. Can't hurt any worse. No,
So where is his back sore actually?
the rotation of right above the SI into where the ligaments are going into the lower back off the pelvis.
see, it's limited that I can't bend over and pick something off the floor.
Well, that could be God's answer too if you've been doing too much, John.
Yeah, well, like I said, Saturday it should be over. As
Until you
far as-
start hanging cabinets.
Oh, we're not doing that. We're paying to have that done.
Okay. Good.
We're paying to have the new tile floor. So
So-
after the mud and tape guys leave Saturday, then we're gonna paint.
Very similar to like I did on your face. The bone right in here is very sharp to the touch.
The
I've had-
transverse process or the what?
I don't know. I'd have to look at the skulls. I really am not good with anatomy.
I mean, does it feel like it's an
It's-
outcropping of the
No,
spine or the
no.
pelvis?
It's just that I
Or that
I
SI
have
joint.
learned. No, I have learned like here, your tonus is much too hard on the shin bone, and literally you can get a lesson from me, and the tonus will change in
Ah.
a lesson. Don't ask me how bone tonus can change. So if I touch someplace and I'm like literally like I'm knocking on,
Yeah, yeah.
I know to hang out there and allow.
That's really very
Is
interesting.
that better,
Mm-hmm.
or is that still hurt?
It still hurts, but it feels good because at least it's moving.
So now this is the first time going after the bow of his back to where I can apply this kind of pressure going through the chest cavity to rotate so he's over his pelvis forward. And like I said, that's now more the surgery. So now, is that better?
It's getting better.
Okay. So you'll see the much more movement.
Yeah, it doesn't hurt as much now. So that next week you go to cross the water?
I go Maui next week. And end of April I go Bahrain.
All right.
There we go. See now?
Wow.
The arm before and after the vestibular in the front brace.
So which side of the spine are you on? The side
I'm
closest to the shoulder blade?
actually below because I'm rotating down to allow, but I could be up here just as easy. And now, what I did with you more so again, go right here, very subtle, more with the thumb, but twist. So my left's going down, right's going up.
And your fingers are on the muscles on the other side of the neck?
Yeah, probably. I'm just
In the sort of organic...
looking to put enough tension. So again, it's just like pulling a towel or... By the way, John, I'm sorry. This is your lesson if I'm talking too much, you know.
No, fine. I'm interested in hearing you say what you're doing.
Yeah, it's kind of fun to hear it described as you're feeling it.
Yeah, John likes that.
I do too.
So now, see walking?
Mm-hmm.
Now you can watch quick.
What are you doing there?
So again, this kick's not here, right?
Oh, okay, so you're moving the heel.
I'm moving the heel, but the kick's not, it just
Mhm.
happened, right? See, now look at the difference. So see if he were to roll over now, see how that heel now can flag up and kick? So I'm gonna do it a little bit more, bring it down, and then, see? So just that little bit. There we go. See now, the tone is.
Astounding.
Yeah, she found some buttons down there.
See,
Yeah,
now
well,
look at
she
how
did
the
on me too.
See, now I got the circle. Before I just had back
Wow.
forth, but now, see? Off now.
Wow.
Now he's a dolphin. See how a fish would go? See how the feet, yeah, just go for a ride even. So see that? Now John was quick too, because even though he's not a practitioner like you are,
He's responsive.
he comes to me so often that
Yeah.
his body's just, what are you doing to me, Michelle? So now I can totally take him.
Wow.
Hold on. Now this could be just because he's got shorts on too, or he wasn't expecting it. There you go. Chest is your chest is fine, right?
Yep.
So this is,
Great rotation.
but that's probably the first time we've been able to do that.
Wow. Since his
But
surgery.
also, now notice how fast the arm can go around. The acceleration totally changes. How's that?
Yay.
Shall I leave you lopsided?
Yeah, we gotta do the other side. I'm gonna go in circles.
Now, I'm gonna just tease you. Could you mind walking around first and then come back down? And...
Oh, this is not a tease. This is fun. I did this too.
Now already, because of the way his back presents, I'm gonna go right to the arm. I don't have to work on the vertebrae as fast, as much. No, you're okay. So I have to go very, very slow because I'm getting him to rotate back instead of the arm coming.
Well, I wasn't fully relaxed either.
That's
I just
okay.
now had a big relaxing area there.
But see how the elbow's coming back and the shoulder's staying forward.
Yeah, I do see that.
So the rotation of the shoulder's just not there. So with that, I have to work on. So I'm going to change hands on this side. So I'm coming in here and I'm going to go more upper bicep.
Oh, that was the other thing. I have pain in my upper biceps on both sides, and what you did alleviated that.
Oh yeah, because of the total rotation.
Yeah.
Because when you have the rotation there, then the bicep doesn't have to, your bicep was catching like most people's wrists catch. So, and then it couldn't twist over itself. You might have to keep integrated a couple more times, in the next couple of weeks yourself, but. See, I'm not forcing. I'm looking for the space where his body knows how to bring the arm back. So what I'm going to do now is the neck. And see, I'm pushing down on the neck and pulling back on the shoulder.
Are you rotating his head at all?
Not so much rotating the head, but I'm definitely
Rotating
rotating
the-
through the
In the back there?
C1, C. So I'm pushing up, rotating to
Let's
C1.
say her thumb is going up.
Right, but my fingers are going down on 3, 4. So I'm twisting up through the neck.
Oh, torque.
Yep. So here's where he really has a problem. So the way I put my hands here, and you can really feel it through back here. So with that, I'm gonna come in here with my hands, so again, protecting his vestibular, and now I'm gonna lift the neck and push down into the upper part of the shoulder girdle.
So you're lifting with the right hand and pushing down on the left hand.
And pushing down with my arm.
And drawing him.
There we go.
Yeah.
So now I'm gonna pull and lift. Pull at the neck, pull the shoulder. And now I'm gonna let go. And now I'm just gonna see if that made a difference.
And now the head is moving.
But the
in way
shoulder
that you
wants to
like.
come down. Now I still have a catch right here. And it's through the chest, so I'm lifting
How
here.
did you determine it was through the chest?
Because if I actually try and lift, so there's no extension. So like I work with your head, there was no extension through the ear.
So it sort of stays where it is.
Yep.
My chest had some severe trauma.
That's true.
Hey.
Can be forgiven.
He's like a 3-year-old that had this done. Want to see it?
I couldn't believe I had to have it
Did they
done.
give you stickers too and lollipops?
No,
There we go. See
I
the
just-
difference now?
My big red heart pillow did it.
Also look at how the knee is lifting and the foot. See that? There we go.
Yep, that feels phenomenal.
And this is sawing, this is hammering nail. I mean, this is,
Yeah, I've been doing all that.
yeah.
And how old were you when you had your surgery?
71.
Well, you are a hard worker.
Oh, he's always been.
Yeah.
He'll climb the orange trees to get to clean the oranges. He's,
Yeah, I was up in the tree with Myrna, and she said, "You're over 70. You shouldn't be able to even do this." And I said, "Do what?" Climb the tree. I said, 1 foot there, 1 foot there, and pull yourself. What's hard about that?
but John, to my work, my sink's clogged. Oh, go see Michelle Turner. She'll fix it. If there's anything wrong in your life, it's just go see Michelle Turner. If I asked him to wear a big billboard and walk down the street, he would do it. So now here, this bone right here won't flag. See?
Oh, yeah.
See, this is where, again, this is tuning a Steinway versus just doing pianos. So with that, with the flag, so watch the relationship to the wrist. So I'm going to come here under the wrist. So as I'm pulling back, I'm lifting up. See how already he knows there's a fulcrum here, just like a kid on a seesaw. There we go.
Now,
And
why
again,
was
this-
that not moving?
I don't know. Again, you could have banged it on the wall last week. You could have been in this position the last time in 1957, so you haven't played with it. But see now, the flag of the, how you can, and even the nose. So that's the counterbalance through the whole system. See the ankles through the knees? We look at that as there should be movement, but that's a counterbalance. This is when a little kid goes, boop, boop.
Ah.
See, now it's a little heavy here for my liking. And again, that part is experience. I know what an arm should weigh. I know he's 6'4". I know he weighs 185 pounds. Blah blah blah.
You know the feel
But
of
there's
his
still
arms.
a tonus heaviness. And I lifted the baby this week, and let me tell you, his head was much heavier than this arm. So as a 6-month-old child, if a head presents to me that heavy, that kid ain't sitting up. You know, there's no Feldenkrais behind, like duh.
Yeah, for sure.
However, the baby can't figure it out. Okay, here I'm rotating. Never done this before, but look at what it does.
Oh my God, that's fabulous. Does it feel great?
Except in my head, I'm hearing da 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 da.
She's got the human body
There we
figured
go.
out.
Yeah,
See the wrist? That's the ATM right there with the wrist.
she really understands something deep.
But see, like I said, John's brain allows me. Oh, I didn't try this. But see, now look at that wrist. Look, see
Yeah,
how they-
wow. Well, and it's
Rotating.
And my head's moving.
Now,
I'm gonna have so much more appreciation for
see
all
the
of
difference
John's
now? The head,
videos.
I haven't worked on the foot at all, but look at the
Yeah,
difference for
yeah.
how the,
The whole leg is connected to the torso now.
but it's also, you know, I credit 98% of this to John. John's fun. My brain just goes, wee-hee, party. You know, I get to, even though I'm helping him, he specifically came to me, I did too much, my lower back hurts, but he's still fun, you know. So now I'm going after why he came to me again, which is the lower back. So right now, I'm just, all my brain's saying is, I acknowledge that you told me that this area was bothering you, so I'm just saying, hi, how are you?
Yep, I can feel your thumb right on it, or close, or touching something.
But by the way, what we just did with his arm, look at how now he can get out of the car. That the hand can lead him getting out of the where most people's age have to, I call it the 3-point turn, they have to, you know, move sideways and then get out.
Last time you were pushing on my spine to do something to a vertebrae or something. Like you said, pushing them back in, or
Mm-hmm.
which hurt, but not that bad. Felt better. That's due to my surgery too, and favoring.
Sinking the spine in, floating the lower ribs, floating the pelvis towards the ribs. There we go. Again, C2 has speeds now changing.
I think Mueller said he'll be at that Italian restaurant on the 16th.
I won't be here. I'll still be in Maui. I get back the 17th.
Just thought I'd tell you.
Thank you. He'll be in here in a second. Not in a second. You actually, believe it or not, we're doing all this, John, and it's only 1:35.
Good.
Normally, though, that's the only bummer with John. I feel like I've worked on in 10 minutes and I look up and it's like 5 minutes to lesson over. So now here, I'm working on the same thing. Knee is a fulcrum point, lifting the foot off of the hip. So, that's all here. So see how I'm into the hip? I'm just under the heel. So first of all, I'm just looking, I'm gonna itch. So I'm just looking at the weight of the leg. And again, he's got a really long femur, even more so lower leg. He's like a spider. He's got a very long leg. So his lift factor is going to be completely different than someone like you. There we go. See how I'm twisting the heel a little bit back? So see how the stress is going through the knee? And there we go. So now if I wanted to, let's see if this will let me. There we go.
Oh yeah, that feels really good.
Can you go really too far with that and hurt somebody or not? Or does it just sort of not go?
I don't think so.
Well, yes and no. This is where you have to know better. If I couldn't even lift the leg, I'm not going to turn around and rotate, and I didn't see the rotation through the knee, so now I have a whole conversation. So now I can sit down even and do it. He's all available for me. But you can't just take someone's foot and hip and go, and especially too if you haven't done the back thing. So if that chest isn't available, if there's still an inflection, especially if they have pain, then yeah, you can really, I don't think I'd send someone to the hospital per se, but it's an advanced move. This isn't something I would do on a first date. But, you know, John and I have been having an affair for a very long time, so that's fine.
Better choose different set of words.
Did that on purpose.
I know. Maybe he's got a hidden microphone.
Sorry. There we go. So now the hips up and around total rotation. Whee! And see it in the shoulder and the wrist, all that there. So rolling over as a baby, that's where you get it. You'll see we work all the time with the babies because babies that have problems, their feet are in front of the pelvis. It's very hard for them because of that balance through the pelvis to bring the foot back. But that's true rolling over as a baby. So if I roll over, I'm like this, I'm stuck. My feet go back. And
Oh,
rotate.
yes, yes.
So now John's just a big baby. Now his back is totally available for where I can do what I want to do with it. See, as I push him even to the back, how the head just flows back, he's not shortening the neck even. So that means the spine's totally swaying to my, for every action there's a reaction, and he's right now again, law of minimum physics. As I go up, his head goes off, he's totally countering down to the toes. So I just go in, it's like kneading bread. Thumbs are going in, light lift, and coming back.
Well, that makes that area that hurts just wonderful.
See how he goes in, it's like a fall, comes back, nice changes with the tonus. It feels really good. Any kind of rotation, especially with the chest cavity, with the balance like that, he's integrating with the foot being back behind him, on top of it, rolling over through the chest cavity onto his wrist if he was to roll over again like a baby. So all of these little nice baby-like movement are integrating, and it feels really good. There we go. Now I got circles. And this is infinity. See how my circles can oppose one another. Same, different. So now I can go back and again fine tune more. So there's a spot in his back, which we've dealt with before, John and I. So I'm going to give him a little extra, again, just because he's got the tonus of a 6'4" man, not of a little kid.
Does he ever get knots or sore places under his shoulder blades?
Yeah, but they go away quickly.
With you, yeah.
She puts her thumb on it and it vanishes.
So now, see how I can just take the shoulder
Oh my,
and
yes.
totally rotate the
Yeah.
hand. To do it a bit more clear, I'll take it because again he's a big boy. So watch how I rotate opposing with the shoulder. And if I really was interested, I can go like this, but he's just really light.
Boy, yeah, wow.
See, now I can just,
And he's making circles with his hands.
oh yeah.
As he's
And
making
his
circles
nose.
with his shoulder and circles with his nose.
She's having her way with me, I
She
can tell.
is.
On your back, please. How's that feel? You take one pillow out, please. Now, if John comes in, do you care or you want the drapes closed?
I don't care. We were out to dinner with him last night. It's not like,
Oh. I asked, not a, yeah, they're on my desk.
thank you for asking.
But, yeah. I had one guy here and he's like, actually, I'm really private, can you please, because he came with friends. And then he practically had a meltdown on my table, started crying. You touch me as if you really care. I'm like, oh, yeah.
Has she done this to you?
Yeah, this morning.
Yeah.
She got the treatment this morning.
Oh, God. That is beyond.
Pretty good, huh?
Oh,
So same thing here, lift.
I can't sit down on pencil and paper and write down how good this feels. Can't do it.
And the
That's my
point of-
problem. I can't sit down with pencil and paper and say why I'm doing what I'm doing. So that's why I'm trying to record a bit more, really, so I can catch my little 1 or 2 words of brilliance here and there, and hopefully
And so you're lifting from,
you're just going right behind. It's not the mastoid processes. You're going almost right behind the ears.
behind the ears.
And I'm just looking to see if he's got that lift of the head. And
Right, okay.
now, he's just about there.
And I'm going to get to do that to you tomorrow.
You better. You can't leave until you can facilitate that. How's
Good,
that?
perfect.
You found somebody to help you.
Yes,
So-
yes.
See the difference now? There we go.
Oh my, look at that. Huh.
See how he's going up and down at the same. And see, John's great. See, John, most people be like, "What are you doing to me?" John's like, "Oh, you got my head. Okay, great." See, now, literally I can throw, right? Which, again, I wouldn't do that with the average person. I'm taking advantage of John, sorry.
Don't say you're sorry, it's a sign of weakness. That's from NCIS.
Oh.
I never like to do something to somebody without permission. So here, the whole lower back is, in a sense, stretching, and I'm taking advantage of it. So I'm pulling like slow, tug of war, like this.
And you're
slow.
slightly rotating them to the left.
You have to go with, not only am I rotating to the left, but counter.
Pulling and,
Torquing.
If I was just doing this, this
Yeah.
would be left and pull. And it doesn't feel nice to John. But it's like taffy, or like a big,
well, and you're using your whole self.
You have to, well,
Yeah,
that's-
right. And we were taught that too. It's just sort of foreign, but it's not foreign to
this
you.
way. Even my knees,
Yeah.
That's why this table
Yeah.
is built for my size. This is my table.
Mm-hmm.
So now, see, there you go. This is what John likes.
So now you're sort of circling those vertebrae?
Just circle.
1 and 2, or 3 and 4, 3 and
Yeah,
4?
the whole neck. Going all
Whole
the way
neck.
down to C7 and up
Mm.
through the mastoid, C1. But see, look at the nose. That's what I look for. Okay, John, tighten your left hand, please. See the difference?
Yeah, huge.
Yeah. But
Huge.
see how he doesn't flag. That flag is, how do I put a name to it? I can't, all I can think of is just, the way the flag is, that wind hits it. Ooh, let me try something new. So, John had his chest cracked open, so let's just see the relationship.
What are you doing with your left hand?
I am seeing the torque, so if I go sort of like to the blue ball, the corner of my room, I am pulling his nose towards me.
So you're sort of lengthening
Lengthening
between
but
these spots.
twisting
Lengthening while
his
twisting. Yeah.
face. So I'm looking for the torque of his nasal cavity through his chest cavity. Can you feel it, John?
I can't even imagine that.
Oh, don't try. Just feel.
I am.
Ah, see right there? Feel even the tension through your ear, John? Feel that?
Through my ear.
So
I know, she said that to me today too, and I went, wow, I do. And I don't know if it was imagination or on my part, but I was following what
Okay,
she...
what am I gonna feel in my ear?
well, it was just resistance.
She's a momentary.
So see how I'm bringing the vision back and his looking through midline after the surgery.
I feel good to move that chest around like that.
Okay, let me leave the nose alone. Feel the difference?
I
See how the
do.
head responds and it can just float in space, which is a valid movement. This is fine. But look at the difference. Now do you feel it? See how your whole spine's included with the way the chest is twisted. You see it?
Just by holding the nose.
Yeah. So Carol, again, let it go. See how the spine doesn't react? See, cause and reaction. It's just going very lateral. See? Now the whole spine and the chest has to be included. See how the chest has to twist. Right there, there's a spot. So see how difference here? See the nose is lighter? And right here, feel how it's thick, it's tighter or whatever in the head? I still have to go over here. So now it would be, I would really prove my point with John. At this point, if I made him walk around, but I'm not going to. But John, just move your head around and or lift this arm up and feel it. And then do the other side.
Uh-oh. That's a little heavy.
So now
Much
this,
lighter.
see how much more the chest moves with that though? Can you see it?
This ain't working right. I can't
See,
go
he's
home
off.
like this.
Rotation's
The
off.
video you saw was the one where she had my arm like it was broken. You haven't
The
seen?
pendulum?
I haven't seen that.
That's one my daughter saw. She said, "Did you break your arm? Is she trying to fix it?"
Funny.
First of all, was that you? And after I said, "Yeah," she says, "Well, your arm. What's wrong with it?" I said, "It's
It felt
moving,
great.
moving like it's never moved before."
What I was working on was his relationship to gravity, and technically I should hold you by the
Oh,
wrist,
yes.
and the elbow acts like a pendulum. Again, I just go back to pure physics, which you'd think I aced it, but sucked in science. But all of a sudden, it's like I get it. I could sit down with Hyman right now and just have a party with the guy. Yeah, can you feel the tension though through the face?
Mm-hmm.
But just like I was sort of doing with you, Carol, with the horizon points, I'm just incorporating it into the chest. See, the chest just went. See, now look. See the counterbalance?
Well, you couldn't do that a couple, 4 or 5 weeks ago.
So now lift this arm. That's starting to feel better?
Still a
I'm
little
not done
heavy.
yet, but
Yeah, it's still heavy. Not like that.
keep working. Huh?
See, where's your thumb? That's a sore muscle, I think.
Even this, I'm not just pushing over to the left. It's a push with just if I was punching. Very important, especially in through the shoulder girdle. Always keep that rotation.
Well, I don't think that arm has moved in that position for a long time. Felt stiff.
I'm going to be hanging out for the rooms this whole time. Okay. So basically, every time I'm touching the chest, I'm doing a counter touch on through the nasal cavity. So now pick up this arm, see if it got better. The other arm. Much nicer to the pelvis, this arm.
This arm still feels a little heavy.
I gotta hit the pelvis. Ah, there it is. See, I can't present your, this one I will be able to.
I'm broken.
No, you go under the knee, down here, see, look.
Oh, yeah, yeah, wow.
Huh. So with that, see, the knee can counter, so lift up this left arm. See? See how the hip went in? Down, countered.
Do it again.
So here, see how he goes down? Counters.
Mm-hmm.
Now lift up the right arm. See,
Not much.
doesn't have the pelvis movement. So here. See, that made a difference.
It did.
Yeah.
Huh.
That's
Well,
amazing.
that goes back to baby, that counterbalance. As he lifts the right arm, the left should counter to take the, let's see already. Yeah, see, yeah, there you go.
Which, of course, eventually mimics walking.
Right,
Yes.
climbing and crawling, yeah.
Right.
So, yeah, the baby's sleeping on their back, they blow out their pelvis because they're not on their bellies, where they can start getting that tactile and information, because it also forms out the pelvis is different. Very similar to having his chest cracked open. He had to keep his chest like this to protect the chest. And again, that was there to protect him. It was a medical necessity, but now I'm taking the protection out of his system so he can just react. So now, there we go. That's much nicer. And with that, I'm just going to give him a little bit on his feet to give him some grounding. So he doesn't fly out of here by being so light on top and oof. Okay, good thing I'm working on his feet.
Problem.
So what did you notice? Just a lack of movement?
Yeah, the arch didn't want to respond. But again, I know John, he's my quickie. There we go. See, I can rotate the heel. So at any time I should be able to take someone's pelvis. Now I haven't done this leg, so it's the difference. This is getting in and out of a booth. This, I got problems being a passenger in a car. But again, there he goes. He's a quickie.
She likes to make me a rag doll.
There you go. And that's walking, running.
Mm-hmm.
See, his diaphragm's even flopping.